Well, we continue our coverage on Mental Health Awareness Month, a time to shine a light on the struggles that come with mental or behavioral health disorders. And that includes the loved ones of those that are struggling. And here to discuss this and more is Andrea Sonnenberg, mental health advocate and founder of the Los Angeles Youth Mental Health Coalition. Good morning to you, Andrea. Appreciate you being here.
My pleasure. Nice to be here.
Thank you for being here. And I want to share more of your story. I think it's obviously, we had some other folks on the last couple of days, and I think it's always important when people hear firsthand stories because it personalizes and also gives people hope. So I'm glad that you're here today. Mental health is near and dear to you. Your late son, Bradley, suffered from anxiety and depression, and he died at 7.5 years ago from psychiatric drug accidental overdose. Tell me a little bit more about your son and why you're so passionate about this.
Well, first off, he was funny and intelligent and irreverent and talented. He was creative and sang and was an actor and all those kind of things. So he was just, amazing. One little tidbit is that he bought a Bitcoin years and years and years before we even know. He was like a young kid.
He was ahead of it. He was ahead of the curve.
He was ahead of the game. He struggled since he was very young with mental health issues, and he died when he was 21 years old. With every medication in his system had been prescribed to him. And he still died with the combination of the drugs, which unfortunately sometimes can happen. So he is near and dear to my heart, and I decided to take the work to make the focus of my life, trying to help others to not suffer the way that we suffered.
Well, that's beautiful, and I know that he obviously loves the work that you're doing right now. Tell me a little bit more about just that journey for you, from going from that tragedy to getting here. And I mentioned back what I said moments ago, there's someone right now who may have been going through the same thing and would love to hear more about this journey.
Yes, well, absolutely. As you can imagine, it was traumatic. It was almost didn't want to go on. And I realized the way to move forward was to turn my pain into purpose and to take what had happened to me and use what I had learned and the experiences that I had to help other people so they wouldn't have to suffer the way that we did. And that really has been transformational for me and for the other people that are experiencing what I have experienced and have not ended up with tragic results like I did, knowing that there is hope and there's ways to move forward and ways to help your family member.
Andrea, there is hope. There are ways to move forward. Tell me just maybe the number one thing or a couple of things that you would say that are the difficulties of raising a child struggling with mental health disorders and kind of how you were navigating those things.
So one of the most difficult things is the shame that's affiliated with mental health issues. So the biggest piece of advice and the thing that I've learned is there is no shame, and you need to reach out. You need to share your story, because you will find that there are so many people that are struggling the same way that you are. And you will realize you are not alone. All of us are impacted by mental health, be it a family member, a coworker, a colleague, a friend, somebody's relative. It's there, and it's common. 1 in 4 of us are struggling with mental health issues. So if you can reach out and share your story, you will realize you're not alone. You will learn about so many resources that you didn't know existed, and you will be able to gain the strength and the knowledge to be able to support your loved one or yourself.
It feels like, and again, I emphasize on feels that we're doing a better job of destigmatizing it as of late. It seems like people are coming out more. You have athletes who are coming out and saying, hey, I go through this, Kevin Love being one in particular who have talked about this. Let's talk about the fact that you founded the Los Angeles Youth Mental Health Coalition. What's the goal? What are you trying to accomplish with this foundation?
So the goal is the bringing together of all these organizations in Los Angeles. It's the Los Angeles Youth Mental Health Coalition that are doing amazing work in this space. And there are really so many organizations that are doing great work, but they're doing it separately and they're doing it in their silos.
Right.
I want to bring them together because I want them to share best practices. I want them to not reinvent the wheel. I want them to see what an affiliated organization is doing that might enhance the work that they're doing. Let them come together and create a strategy for youth mental health in Los Angeles.
Well, I love that, and that's why you have the Youth Mental Wellness Day.
Yep.
Tell us more about this day.
So coming up, Sunday, May 4th, we have, and the thing that's really unique about it is it's decentralized activities all around Los Angeles. So it's not just one spot. You can find a venue that is convenient for you, that works according to your time schedule, or works according to your needs and your interests, and sign up. You have puppy events and yoga and mindfulness workshops and art therapy and hiking and you name it, we've got activities that are set up for people to take part in.
No excuses. So many things they can get involved in.
That's exactly right.
Andrea, thank you so much for joining us and sharing your story. And I'm wishing you the best for this event coming up on May 4th and also everything else. And right there, you see it right there, Andrea. We got their website on the screen, so folks can take full advantage of that. It was great meeting you. Thank you so much. We appreciate it.
My pleasure. Thank you.
And if you or someone you love is in crisis and need immediate assistance, please dial or text 988. If it's not a crisis, but you still need help, consider reaching out to a friend, a family member, mental health professional, or find someone like Andrea. All right.